how much do we really know about what's happening inside Arizona's nursing homes, assisted living care, and other long-term care facilities?
According to Arizona AARP, not enough. We know 1,200 Arizonans have died in nursing homes as a result of COVID-19. Many staffers asked to keep working even when they were showing symptoms because there just weren't even enough workers. 21% of Arizona's nursing homes still are not fully staffed.
So the pandemic really bringing to light problems that have existed for years. According to the Kaiser Family Foundation, in 2019, 94% of Arizona nursing homes had deficiencies or problems that could have put a patient's health at risk. Now, AARP is asking Governor Ducey to fund an audit of every long-term care facility in our state after he decided to disband the state board that licenses and regulates these facilities. Our political insider, Mark Phillips, taking us deeper tonight into what AARP thinks an audit could solve.
There are more than 900,000 AARP members in Arizona. Many of them will need the services of assisted living facilities. The job of finding a suitable one often falls with the family.
We want an audit of our long-term care facilities.
AARP's Arizona State Director, Dana Marie Kennedy, made the request official. In a letter to the governor, Kennedy wrote, "The pandemic has generated new challenges for everyone, but has definitely exacerbated the existing problems in our long-term care facilities."
We need to look at, the licensing of these facilities. We need to look at how much how much they have to pay in fines, the staffing levels, the training, that the staff is receiving.
The governor did not extend the term of the board, which oversees long-term care facilities, after learning it licensed a convicted felon as the administrator of a Prescott area nursing home. 15 residents died of COVID. Staff who displayed symptoms were forced to work. The Department of Health Services will now assume the nursing board's duties.
New Jersey did this in June during a COVID. They did an audit and they wanted to get to the bottom of what was happening in their long-term care facilities. And I think that the governor should do the same here in Arizona.
There are 2,200 assisted living facilities in Arizona. Kennedy says very little is known about them because they don't have to publicly disclose their data of cases or deaths. Mark Phillips, ABC 15, Arizona.
Well, there is hopeful news for older Arizonans, especially those